Katelyn. I am a licensed esthetician and massage therapist. And then Dr. Pak Kim Wee, we all know. So obviously we're going to be talking about the natural approach to pain. I'll be covering a little bit more of the massage therapy part. Dr. Pak Kim Wee will be covering a little bit more of that acupuncture, some different supplements, and the cupping. So what is massage therapy? Massage therapy is manipulating the soft tissues of the body. So that is to help relieve some stress, help with circulation, range of movement, and promote some extra relaxation in our life as well.
Take a note.
So some of the soft tissues in our body, of course our body is made up of many different things. Some of the things is obviously muscle. We all know what muscle is. Muscle helps us move. Muscle also is in our organs, helps our organs just work the way that they're supposed to. Obviously our heart is a muscle. We definitely need that. So muscles are very important in the body, but that is one of the major things that massage addresses is the muscles of the body. And then we have ligaments and tendons. The ligaments are going to attach the bone to bone, hold bones together. The tendons are going to attach the muscle to the bone. So those are just kind of attachment, kind of soft tissues. And then we have fascia. Fascia is in everything in our body pretty much. It supports our organs. It kind of keeps all of our organs in place where they're supposed to be. Our muscles are all wrapped with fascia, so we can tell the different muscle groups. Fascia can also get tightened up. Fascia can also get those adhesions in it, scar tissue, all of that. So when we are massaging, it's definitely addressing a lot of that fascia as well. Cartilage, we don't really massage too much of the cartilage, but cartilage is found in our body quite a bit. Our knees, our nose, our ears, of course. Cartilage does take a little bit longer to heal. It doesn't have as much of that blood flow. We'll learn a little bit more with the cupping and everything. Blood flow promotes healing. When we have that healthy blood flow, our body can heal more efficiently. And then nerves. Nerves are obviously made up our brain, but nerves are throughout our whole body, and nerves are kind of a communication system from our brain to our body. So nerves, you can affect it with massage. Even your prime example is sciatica. That is a nerve issue. Sometimes it isn't that true sciatica stemming from the back. A lot of the times it's that kind of imposter sciatica, where it's going down through your glutes, and the muscles in your hips and glutes are actually pinching that nerve. So a lot of people think, oh, I have sciatica, it's awful, it's in my back. It's sometimes just really tight muscles kind of pinching off. Same thing in your neck, you have a lot of muscles there. People say, oh, my fingers are going numb, I can't feel my fingers, it's weird. A lot of times it's the compression, the muscles are squeezing the nerve so much. So massage definitely can help with some of that nerve pain through loosening the muscles as well. And then we have some different types of massage therapy. So someone comes in and they're like, I want a massage. And it's like, okay, what kind of massage? Your normal relaxation, kind of long strokes, kind of that fluffy massage, relaxation massage. That's going to be your Swedish massage. Hello, Matt. Come on in.
Oops, almost.
There's a couple seats here too.
Okay.
And that row. Yes. And then we have our deep tissue massage. Deep tissue. A lot of people say, oh, I want deep tissue because they want firm pressure. There is a difference between firm pressure and a deep tissue massage. Firm pressure, you can kind of work quick, get in there deep. Deep tissue, you are working very slow. You're kind of going through layer of muscle, kind of just working through it as it loosens up. So deep tissue is slightly different than your normal massage. Lymphatic drainage massage, that one is great for just helping your lymphatic system, but also if your lymphatic system gets backed up, you can assist it and kind of help drain things. For people who don't know, your lymphatic system's kind of like your garbage disposal of your body. It kind of picks up all of those pathogens. It goes through your body, gets all of those toxins up and out. So your lymphatic system is very crucial for your healing process. A trigger point, like I was talking, those knots, those are trigger points. Those muscles get knotted up, the fascia can get knotted up. So really working those points, loosening them up is a big part of massage. I also do cupping. My cupping is a little bit different than Dr. Katelyn. We're going to explain a little bit of that. So I have these soft silicone cups. They are really great. You stick them on, and then with lotion you can move them around. If you guys want to pass them around, you can see them. And then Dr. Katelyn, she has these glass cups. So she'll explain a little bit more what those do, but she actually works with fire. Mine is just strictly the suction. Mine don't go as deep, a little bit more superficial. Hers is a little bit more of that detox and everything gets a lot more going. Myofascial release, that's the fascia that I was talking about, really helps release that. Sports massage, lots of stretching, really working those muscles and getting them. You might get a bruise on your forehead if you do that. You might not want to.
Vicky.
Have you guys
Yes.
Get it passed down
We
there?
got one over here.
And then neuromuscular massage, that's what I was saying, kind of helping the neurons in your body as well. Reflexology, that one is super neat. Everyone thinks, oh, great foot massage. Your feet, your hands, your ears, there's a few different areas on your body that are reflex points. You can go a little bit deeper into it if you like, but pretty much your feet, your hands, your ears, they kind of have the layout of the body on it, and in the Chinese medicine, they have learned that if you press those certain points, it does affect our organs in different parts of the body. So you can do that with massage, you can do it with acupuncture, you can kind of hit those reflexology points in different ways. Then we have gua sha. Gua sha is great. So that's more of like these little tools. So gua sha, you are sitting there and you are rubbing, you are breaking up the adhesions, but then when you are doing that, it also causes a little bit of that redness. It just helps bring that circulation, helps bring that blood flow to it. It should leave a tiny bit of a bruise, but nothing major. But you will get a little bit pink from gua sha if you're really scraping good. So gua sha is awesome as well. So I kind of went over a little bit of these, but just kind of going back into how massage helps. This is something I found very interesting though, that the most common cause of long-term disability in America is musculoskeletal kind of things. It's a lot of arthritis, it's a lot of just muscle tension and a lot of migraines, like all of the stuff that we can help with. People are getting on long-term disability and just not living life the way that they should or the way that they could. So massage, acupuncture, cupping, everything really, really helps. And if you can go this more natural way before you get down that path, try this out before. It'll save you a whole lot of money. It will probably be much better for you, just going a little bit more of that natural route. But with massage, it helps relieve some of those muscle tensions and pains, of course. The nerve compression, like I was talking about, bringing that new blood, like I was saying, new blood brings healing. Lymphatic drainage, helping with some of that inflammation as well. Sometimes you might just wake up and you're like, my face is puffy. Sometimes doing a little lymphatic drainage massage will just help bring down some of the inflammation in your body as well. So increased range of motion kind of rebalances everything and helps calm down everything. So massage is very good overall, and it feels amazing. So we definitely love that. And then just some different conditions. I think I touched on pretty much all of these: muscle tension, sciatica, the migraines, even like TMJ. I clench really bad at night. I have to sleep with a night guard. So all of this in here is very tight. Even talking throughout the day, you don't realize how much tension is in your face. So TMJ can really help with those migraines and even jaw pain as well. Plantar fasciitis, that one is a big one too. A lot of people really, really like that for the massage specifically for plantar fasciitis. So if you go to a doctor, they're going to say, okay, we'll put you under the knife and we'll cut it out and you'll feel better and do a bunch of rehab and that stuff. A lot of times you can work that plantar fasciitis muscle, and you do get a decent amount of relief from it. You do have to come back a couple times. It does build on each other. So, of course, going to the surgeon, you go one time and it's done, but it's also all of that healing and all of that. So, if you get a massage, it will be a little bit more treatments, but you'll probably save a whole lot of money and feel a whole lot better.